speaker is going to be Ms. Robin Davis, President and CEO of Global Health Action, Inc. in Atlanta, Georgia. She has over 35 years of experience in international health and community-based program development. She leads the Global Health Action's effort to improve global healthy growth through capacity building efforts, community-based health and development programs, and livelihood opportunities in underserved areas of the world. Thank you.
Thank you so much. It's a real pleasure to be here with all of you. Like Allison, I'm going to focus on China. Certainly looking at the landscape of global health, that's a pretty big topic. So I would like to focus on the opportunities and challenges of various partnerships related to China, both the governmental partnerships and the non-governmental partnerships. As an Atlanta-based international health and development organization, non-governmental organization, Global Health Action has now been working in partnership with the Chinese government agencies and Chinese non-governmental organizations for more than 10 years. We have worked from the national level through the provincial levels, the county levels, all the way to the township levels with our partners. These health partnerships and the resulting programs focus on health and population issues and challenges that are facing China today. And as identified by our Chinese partners, here are some of the current health challenges and the priorities that they're facing. One is building a client-centered approach to health promotion and care, particularly for women, making sure that women and families have the opportunity to be the leaders of their own health care and their own decisions. Ensuring comprehensive health and social services for the increasing aging population. Like the U.S., China is facing many challenges relating to an aging population with a middle-aged class that is not so large. Also, targeting health and development programs for the care of girls. This is particularly important in terms of gender equity, since the birth ratio there in China is 114 males to 100 females. So this presents a variety of challenges from a health perspective, a social perspective, and certainly an economic perspective. So the education, the protection, and the development of girls is essential. Another is providing health promotion services and livelihood opportunities for underserved, marginalized rural populations. We see this in many ethnic areas of China, and certainly there are many health issues, including HIV and AIDS and other health issues in Western China and Southwestern China in particular. Another major both health, population, and social and economic issue is China's growing floating population, where more than 230 million Chinese have left their rural homes in search of work in larger cities. With this, they have left more than 60 million children behind. These children then live with an elder grandparent or are in the care of a community caretaker. They are going to school and living in these communities where they are registered, where they have the opportunity for an education. But this presents many health challenges related to their growth and development. For example, in many of these rural communities and in these schools, there are no programs on adolescent health education, life skills development, or sex education for these children. So this is one of the areas that we at Global Health Action are working on with our partners. Through our long-standing partnership with the National Population Family Planning Commission of China, we've had the opportunity to help our partners in various ways to address these various health issues and priorities within China. We've done this by learning from each other, by sharing new approaches, programmatic tools, and techniques from the U.S. and other countries, and certainly learning from China and their opportunities and their programs. The focus has been on improved client-centered care and the integration of family planning, reproductive health, and HIV/AIDS prevention and care. It's appropriate for an organization like, and an agency like the National Population Family Planning Commission of China to help with HIV/AIDS education, prevention, and care, given that they have a network of thousands of health professionals and clinics throughout China. So this integration of services was an opportunity for them. Of course, this is not without its challenges. Given that there is a large hierarchical structure, and as Allison mentioned, there's the challenge of lack of transparency at times, communication is so key. The information sharing is so important. And we have found that it's an absolute must to have trusting relationships and open communications with our partners, working toward a common goal. Working through the commission, we have had the opportunity to work in partnership to focus on programs that have far-reaching impact. But as I say, the hierarchical structures often do present challenges, but at the same time, there are many opportunities there. China is highly organized when it comes to the delivery of health services. Today, we have worked with more than 700 of the commission leaders that represent all provinces within China and also all departments within the national level. So with this opportunity, they have been able to rapidly disseminate new approaches and new techniques throughout their entire system to address these health priorities. To focus specifically on the issues related to the left-behind children, and as I say, there are over 60 million of them now in China, our close partners that are also connected with the Commission are the Nanjing International Training Center, the Jiangsu Province Family Planning Association, and the Funing County Family Planning Association. With the cooperation and the assessment also of Nanjing College, we were able to conduct a needs assessment to identify specific areas where we might work and develop a pilot project on the left-behind children. So with this, we've identified Lupu Township, 2 schools, it's 2 communities where over 1/3 of the adult population have left to find work elsewhere, leaving their children behind. They only see these children maybe twice a year for festival time. So with this, we're focusing on 1,500 children, actually adolescents, aged 11 to 15. And the focus is on health education, developing a training of trainers curriculum within the schools, identifying student peer leaders, working with them, hand-in-hand programs with college students in the area to give these students the opportunity to see that there is hope to advance their education. Also, there's the psychosocial support aspects of counseling and communication. As a part of this, given that their parents are so far away, we have helped identify opportunities for them to talk. And so we've provided computers so that they can have free chats, video chats with their parents. Many of these challenges continue today. HIV and AIDS, community-based programs, prevention care, livelihood opportunities in China. All of these require everyone working in partnership. So another key partner would be the NGO, or the non-governmental organization community. The Amity Foundation is a large partner of ours in China that helps with this opportunity. So I'll close with just the idea that open, trusting relationships are key to these partnerships, transparency, and if we're all working toward a common goal, we can overcome our differences in policy. Thank you so much for this opportunity.